Thank you, everyone, for joining. My name is Paul Bias. I'm the chairman of the Health and Wellness Committee for the College Park, Sandy Spring, Maryland Alumni Chapter. And we're having our second virtual town hall. And today we're going to be talking about metabolic syndrome. And we've got a lot of information that we're looking forward to sharing with the viewers. And we are thankful to have two physicians in our chapter who are going to take us through the presentations and give us information on a number of conditions that, risk factors in the Black community suggest that we need to pay a lot of attention to these diseases and how to create a lifestyle that will minimize the impact or even the risk that we might suffer from some of the things that are surrounding metabolic syndrome. But first, I want to introduce to you Dr. Kareth Joseph. He is a member of College Park, Sandy Spring, and he is a board-certified emergency medicine physician. He's currently licensed to practice in this state of Maryland, and he's affiliated with the Veteran Affairs Maryland Healthcare System, the Baltimore Division. And also we have Dr. Kester Cross. Kester's medical specialty is gastroenterology, and he's board certified and practices out of Howard County General Hospital. I neglected to say that Dr. Joseph studied at the Howard University School of Medicine, if my memory is serving me correctly. Yes. And Dr. Cross studied at the University of Maryland School of Medicine. And we're just thankful to have them share their time. If any of you all know about these medical specialties, they take a lot of time, and the doctors have responsibilities at the various hospitals that they're associated with. So for them to carve out an hour and a half of their time to just kind of talk to us about metabolic syndrome in this instance is really it's really a privilege, and I'm thankful to be a part of this. Before I turn it over to Dr. Joseph, who's going to kick us off, I want to tell you all that there is no such thing as a question that you should be hesitant to ask, because the information that they're going to share is for our benefit. And not too often, frankly, that we are in front of physicians where we, have all of our faculties and we're not stressed out about how we're feeling, or we don't have this condition or that. So now's the time to actually ask questions, and you can comprehend the information or the responses without, significant challenges to our state of mind, our emotional state, or whatever. One of the things that I want us to do, and this is in my mind, the committee hasn't vetted it yet, is I have a couple of people that I want to talk to kind of walk us through, well, when that event happens, what do you need to do to get all of your ducks in a row? Because depending upon the type of health event that you're facing, you might have modifications to your home, you might not have your records in order, you might need to do some things with powers of attorney. And these are things that we need to talk about before the medical event happens. So there's a lot of things that our committee is planning. We've got 2 or 3 more town halls that are scheduled for the rest of this year. And so like I said, I'm excited about this. I'm excited to hear what these two physicians have to say. And with that, I am going to turn it over to Dr. Joseph. And if you have questions, please hold them until both presentations are complete. Presentation should be done in about 25 minutes, and then I will facilitate the question and answer period. Dr. Joseph, take it away.
Brothers, greetings in Phi Nu Pi, and thank you for inviting me to speak with you about a topic which touches upon so many of us. In 2022, my good friend of nearly 2 decades died suddenly and unexpectedly at 53 years of age. At the peak of the pandemic, he sent a text urging me to take precautions and telling me he was proud of me. Our final text exchange was him wishing me Happy Father's Day. My talk today is something I wish we had discussed when he was alive. Metabolic syndrome is a cluster of illnesses that increase the risk of severe complications from stroke, heart disease, and diabetes. Metabolic syndrome is having 3 or more of the following: obesity, hypertension, diabetes, high triglycerides, and a low HDL cholesterol. These are the tests for metabolic syndrome: measuring your height, weight, and waist size, taking your blood pressure, and getting blood tests to measure levels of blood sugar and lipids, which is another term for fats. And we'll talk about each of these elements in greater detail. Obesity is a medical term. Unfortunately, it has taken on a moral significance or connotation. We say someone is obese if the BMI is greater than 30. And there are charts available online if you want to calculate your BMI. Blood pressure. It's composed of 2 numbers. The top number, called systolic, is the pressure when the heart is contracted or squeezed. The bottom number, called diastolic, is when the heart is relaxed. If the top number is greater than 130 or the bottom number is greater than 80, we say you have high blood pressure or hypertension. And as you can see from the slide, about 1/3 of persons with high blood pressure don't even know it, and consequently aren't taking medications for it. So what? And following is a list of conditions that can result from untreated high blood pressure. So you see that you have aneurysm, which is a dilation of the blood vessel wall, which can cause the blood vessel to rupture. Stroke, which is when there's a lack of blood flow to a portion of the brain and causes death of the brain cells. Chronic kidney disease. The kidneys are involved in maintaining fluid balance and electrolyte levels. And if you develop severe enough kidney disease, you can have high potassium levels that can result in cardiac arrest. Untreated high blood pressure can actually cause vision deficits leading to blindness. Heart attacks, I think we all are very familiar with. Heart failure is a condition where the heart doesn't pump efficiently and a person becomes short of breath with mild exertion. Peripheral artery disease is a condition where there's a lack of blood flow going into the lower extremities, which can result in pain and gangrene to the point where a person has to have an amputation. And then another unfortunate consequence is dementia or loss of cognitive function. And we have these risk factors, which we are all probably familiar with. As we get older, the blood vessels stiffen and contribute to high blood pressure. Of course, genetics plays a role. So if your parents had high blood pressure, it's more likely that you'll have high blood pressure. Certain habits, smoking tobacco in particular, and illicit substances such as cocaine increase the risk factor for high blood pressure. Certain over-the-counter medicines, decongestants that people use for cold or upper respiratory illnesses can elevate the blood pressure, as well as pain medications in the class that we call NSAIDs, particularly ibuprofen or Motrin or naproxen, Aleve. Those kinds of medications can increase your blood pressure. African Americans and Latinos are at increased risk for high blood pressure, as well as men. And finally, socioeconomic status. We know that persons in dire financial straits have more stressors on them, and that can increase their blood pressure. But I would also include people on this program tonight who are moguls, who are very active in their communities and in their businesses and may not get enough sleep. That also can increase your chance for high blood pressure. So all cells in the body need sugar for energy to function. And diabetes comes in two types. Type 1, also known as juvenile diabetes, is when the pancreas does not produce insulin. And type 2, which is more common, the adult onset type, is when there's a resistance to insulin. Most people with diabetes do not have symptoms, but of those who do, you commonly will encounter urinating frequently, or excessive thirst, or blurred vision. These are the main tests for diabetes. We can get a blood sample at random, meaning anytime, or we can get a blood sample after fasting for 8 hours. And finally, we can check the level of what's called the hemoglobin A1C, which is a marker for how high the blood sugars have been in the preceding 2 to 3 months. So we say you have diabetes if you have symptoms with a blood sugar of 200 or more, or if the fasting blood sugar is over 126, or the A1C is greater than 6.5. We already mentioned earlier that lipids are fats in the blood. And cholesterol and triglycerides are types of lipids. We get concerned when the triglyceride level is greater than 150. Another area of concern is if the HDL cholesterol, which is also known as the good cholesterol, is less than 40 in men and 50 in women. And the reason for that difference in sexes is because of estrogen in females. So now I will transition to my colleague, Dr. Kester Cross, MD.
All right. Good evening, brothers. It's a pleasure to have the opportunity to speak to you. These talks are fruitful golden nuggets, but even more importantly, when you have an opportunity, or when we have an opportunity to speak to a predominance of Black men, we cannot take that lightly. I take this time, I treasure it, because us, or we as kings, we are often leaders of households. We have wives, we have children that depend on us. So when a man goes down, when a Black man goes down, the impact is usually 4x. 2 children, a wife, 3 children, a wife. So when we look at that, and then we look at our health issues, staying healthy, why do we want to correct these things? It's just because of that. When we go down, most of the family goes down. And Brother Bias just pointed one of our biggest deficiencies. That also, when we go down, we don't have our affairs in order. So we don't have wills, we don't have life insurance, et cetera. And I'm assuming there's going to be talks in the future. But number one, we don't need life insurance right away if we modify what Brother Joseph was talking about. So with that, I want to say thank you for your time and attention. I'll spend about 5 minutes just going over treatments. My slides are kind of interesting, but there's nothing easy and sexy about treatment for metabolic syndrome. You got to put the work in. But that being said, the reason that this is important is one of my take-home messages is of the members on this call or the people you know, when you look at causes of death, 40% of our causes of death come from these metabolic syndromes. Cardiovascular death and stroke, what Brother Joseph just was mentioning, will be the cause of your death. 40% on this call, 40% of the men you know die from heart attacks and strokes, and the risk factors we're talking about are the main causes. So that's very important because sometimes I talk to you as the gastroenterologist, I talk about cancer deaths, which is 30% of deaths, and then the other 30% are pneumonia, flu, diabetes, but 40%, the biggest bang for your buck is what we're talking about today, modifying your blood pressure, weight, and your diabetes. So next slide. So the American Heart Association, well-respected group, basically put out guidelines that says, hey, if you treat the underlying cause, which is obesity and inactivity, initially with lifestyle modifications as your main target. So when you have risk factors, what should we do first? Well, we want to lose weight and we want to get active. There are no pills that are out there that can get you off the couch. There are no pills that can really get you to modify your diet, but the motivation has to come from within. And I hope to motivate many of you to do whatever you're doing and just to take it to the next level, because we all fall short. I know I'm supposed to be at the gym at 5:30 every day. I end up going 3 to 4 times per week, but it should be 5 to 6 times per day. So treat the underlying cause, which is obesity and inactivity, with lifestyle modifications. If that does not work, family, we start to need for medicines. Doctors are our friends. Point number 2, doctors are our friends. Have your office visits. Many of you have health insurance and some of you do not use it. You should at least see your doctor once per year. But if lifestyle modifications don't work, doctors are your friends and use medicines. And it is hard and fast and shown that if you correct with lifestyle modifications or correct your blood pressure, you could add up to 5 to 10 years to your life. 5 to 10 more Christmases is very, very important. Next slide. So what are lifestyle modifications? Where it's mainly losing weight and increasing your activity. Basically, if you lose weight, that is the biggest impact in your overall outcome. The smaller you are, the longer you will live. The smaller you are, the longer you will live. And that is, hey, if I'm 250 pounds and I get down to 200, I'm likely going to live longer. If I'm 220 and I get down to 190, I'm likely going to live longer. Weight reduction is mainly achieved through diet and exercise. Weight reduction is mainly achieved through diet and exercise. Next slide. So when doctors just throw out, hey, lose weight, and they often don't give goals, targets, and stuff. And so when that comes to me, I tell people a solid 10%. So my example on here is if you weigh 200 pounds, I say, hey, when I see you the next time, I want you to be 180 pounds. If you weigh 250, I want you to be 200 pounds when we come back. Well, how do I do that? Well, there are plenty of sexy diets that are out there. Multiple diets are suggested. I mainly would like people to look at certain diets and find the diet that you like the most, the one that's the least repulsive, because I found in my 20 years, that's the diet modification that you're likely going to maintain and continue, because it's a lifestyle modification. It's not just, hey, I'm going to go on a fast for 2 to 3 weeks and then get the results. So it's a lifestyle modification, and the diet that you like the most is the one to do. What is exercise? Well, some people need it to be quantified, but it's very simple. It's 150 minutes per week. You can accomplish this by 30 minutes of fast walking 5 times per week. You can do an hour, 3 to 3.5 days a week. Well, however you want to break it up, but it's real serious activity, fast walking like somebody's chasing you, and then diet, and that's how you lose weight. Next slide. So what are some popular diets out there? I'll just speak briefly. The Mediterranean diet is one that's high in fruits and vegetables. The low glycemic diet, high in fruits and vegetables. The high fiber diet is one that I like. It works for me, where I just can eat meats and drop the carbs and try to get it. And fiber kind of bloats you up. It makes you feel full quicker. It cuts your calories. And then one pearl is often just to switch to water, limit your drinks, stop drinking alcohol. That is, one of your cranberry and vodkas, 200 calories, one drink. People having 2 drinks, that's 400 calories. And you're trying to get in 1,500 calories a day at a maximum, and that kind of helps you lose weight with your exercising. So whatever diet you like that is cool and sexy to you, besides the seafood diet, I see food, I eat it, you do fine. The main thing is limiting your carbs. So if I want to lose weight, I just don't put rice and mashed potatoes on the plate. It's just strictly the meat, and then whatever vegetable. And then the snack needs to be a fruit, and you do fine. But stuff high in fruits and vegetables, you do fine with on the diet. Next slide. Exercise. Can't minimize that enough. Really just hit the gym. Do whatever you want as far as walking when it gets cold. If you need to get a bike on the inside, invest in yourself. It adds days, weeks, months, years to your life if you lose weight now. Exercise. Lifting weights adds to it. Nothing wrong with being sexy and being muscular. That's fine. You got to get your weight down. And then I just put on this last note that liposuction does not change clinical outcomes. It's a cosmetic thing because it's putting in the work that gets you losing weight and also decreases your cardiovascular risk. So that question comes up to me often in office, because mainly from women. They want to go get liposuction because we know about stomach fat, and that's your biggest risk factor. Well, if I get liposuction, does it make me live longer? No, it just makes you look better to you, but it does not change your overall lifespan, because you have to do the negative calorie, the negative energy mix, and burning off the weight is what lowers the hardening of the blood vessels. Next slide. So medical treatments are needed if lifestyle modifications don't cure your metabolic syndrome. Medical treatments are needed. And why this is important, Dr. Joseph mentioned with diabetes, what are our goals? And I just want to hit the big 3, which is diabetes, blood pressure, and lipids. These are all risk factors that increase your chances of having that heart attack or stroke in that 40% group. So if we modify these, we can add 5 to 10 years to our life. We can add 5 to 10 summers to our life by getting these under control. That's significant. 5 to 10 summers is significant. That is, if it's our child, we go from seeing them graduate from school to possibly seeing a wedding, from graduating from high school, from seeing them graduate from college, from seeing them get married to seeing the kids go to elementary school. These are the reasons we want to modify these things, because 5 to 10 summers are added if these 3 things are modified. So diabetes, hemoglobin A1C, a goal under 7. Someone may say, I don't want to assume everyone knows what a hemoglobin A1C is. What that measurement does is it shows the doctor what your average blood sugar has been over the past 3 months. What your average blood sugar has been over the past 3 months. So it's a really good indication. And if you keep it under 7, you can add 5 to 10 summers to your life. So that's why that's important. And some of us know brothers that you ask them what the hemoglobin A1C, and they're double digits and proud about it. They wear it like a Kappa brand. I was 12 the last time I saw the doctor. And it's like chalkboard for me because I know they're at risk for having a heart attack or stroke. Double digits, not good. You want to get it under 7. The second thing is blood pressure management. Blood pressure is a silent killer for Black men and Black women. The reason it's a silent killer is historically we couldn't go to the doctors. We couldn't work with high blood pressure. We would die off. So the Black men and women that made it through the atrocities of slavery and racism could tolerate high blood pressures without symptoms. Our counterparts get headaches and stuff. They go to the doctor when their blood pressure is 150, 180. We do not get headaches to our detriment when we have high systolic blood pressure, and we can work the fields, we can work in our office, our shirt and ties, but we have heart attacks in our 60s, sometimes in our 50s. 10% of Black men die before 65. 10% of Black men die before 65. The vast majority die between 65 and 75. 10% make it above 75. You understand that? 10% make it above 75. So everybody on this call thinks they're living to be 80. That's a 10% heat, and you want to be in that number, and you need to get your blood pressure under control to increase your chances of being in that number. And what's that number? The top blood pressure number should be under 130. That's the pressure your heart has to push against when it's trying to get blood to your critical organs. And if that number is 180, that's that offensive lineman is pushing back against your heart, trying to get it there. And eventually the heart muscle gets tired and we have that heart attack or stroke. The last thing on this slide is lipid management, very important. Do we have to do diet? Yes, sometimes people like myself, my total cholesterol, my LDL is 200, not on cholesterol medicine. On cholesterol medicine, it's 98, but I take a statin. Some people have genes that they make too much cholesterol. So the oldest cross man, my previous generation was my grandfather. He lived to be 65. There were no statins out. So cross men died in their 50s or 60s, but they all had the cholesterol gene. My uncle is 86 now, and he's the oldest cross man in the next generation. But of course, he's been on statins, and I've been on a statin since I was 27 years old. Next slide. So last important slide, racial disparities. I've said a lot to you about what you can do. I really was just talking to you as a family on the controllables, but the effect of racism cannot be overstated. That's a whole separate topic, but the socioeconomic differences, the increase in stress, lower access to quality medical care, the list goes on. All of these are compounding factors that do result in African Americans, men and women, having lower outcomes. But what we were talking about today with metabolic syndrome is your blood pressure, lipids, your diet, and your weight. Stress does increase your weight, but we're trying to, what can we do to live longer? Fixing racism, yes, it's an ideal, and we need to work on that because the effects of racism are real. I do want to point out that money and education do help, but when you stratify for education and money, a Black physician still doesn't live as long as a white physician, okay? A rich Black man doesn't live as long as a rich white man. When you stratify for money and education, Blacks still don't live as long, and you cannot, again, overstate the effects of racism because that rich man still has rich Black man problems, and he does not have the same stress that white counterparts have. And that has been studied. The effects of American racism take summers off of our lives. And then lastly, what does weight have to do with all this? It has everything to do with it. We are the largest group of Americans, and we have the lowest lifespan. Asians are the smallest Americans, and they have the highest lifespan. Now, yes, they are subject to racism. They are not subject to the same racism and stereotypes of African Americans. They are subject to racism. It's not the same level as African Americans, but it is there. But with them being smaller, they have longer lifespans. So that gives us hope that, hey, even with the effects of racism, if I control what I can control, my lifespan goes up. I get in that 10% range on wanting to be 80 plus years of age. Next slide. So this is the end of my talk. My last slide is just a summary. I hit you pretty hard and quick, but the main thing I want to share is that diet and weight loss are the mainstay of treatment. We have to eat properly and not a sexy diet where I'm doing some fasting for a month and then I'm back on a seafood diet, seafood and eat. That does not work. It's actually more detrimental to lose weight, gain weight, lose weight, gain weight. The heart gets confused, kind of like what happened with Luther Vandross. It's better to have a steady, hey, I'm going to get fit because I want to be 80 plus years old, but eating correctly and losing weight is the mainstay of treatment. If lifestyle modifications do not work, make sure you're happy with taking medicine, happy going to the doctor. These things add years to your life. We mentioned about exercise, 30 minutes, 5 times per week. How much weight do I need to lose, doctor? Well, 10%. If you're obese is just a general goal that shows to have an impact. So it's not a big amount. If you're 250, you're trying to lose 25 pounds, you can do it. But the reason you're trying to do it is because you want to see that kid finish high school. You want to see that kid finish college. And if you get lucky, see that kid get married, see that kid have kids. Well, to see your children have children and see them grow up, you need to get well into that 7th and 8th decade of life. Now, women do that more than us. 30% of women get into that category, but 10% of people that look like me get into that category. And the ones that do typically have low BMIs. So, and then last, as we touched on racism, it is real. And often when I give these talks, there's always somebody raises their hand and talks about it. That answer is yes. It cannot be overstated, but what we can control is we can get our weight down, we can work on our diet, and we can go to the doctor. These are all things and factors that improve our outcomes. And most of us have insurance, but we're just so busy with life that we actually don't get to go to the doctor. So next slide. So that's it for the talk. I'm hopeful now that we have our question and answers that we are in a place that we say, hey, listen, I'm going to change my diet outside of Christmas. Christmas, all bets are off, and Thanksgiving. But more importantly, we don't wait till New Year's to start hitting the treadmill, going for fast walks 4 to 5 times per week, with the whole idea of getting in shape, getting our body mass index down, because we want to add those 5 to 10 summers to our life. Thank you.
Well, thank you so much to Dr. Joseph and Dr. Cross. I mean, this was a really comprehensive presentation, and you all have hit on a lot of the questions that I had, but I do have questions, but I want to just do some housekeeping things. First, if you could stop the share, and I will facilitate the question and answer period. And you'll see my brother Antoine raised his hand. We want you to use the reactions button on your screen to raise your hand if you have a question, and then I will recognize you based on the order in which the questions come in. And so again, feel free to ask any question at this point, because it's not often that we have the benefit of 2 physicians who are willing to respond to any questions that we have. Now, if you have a question that you feel is sensitive in nature and you don't want to ask it, I'm happy to put you in direct contact with Dr. Joseph or Dr. Cross, and they can talk to you offline. You can send them messages privately through the chat if you know how to do that. If not, feel free to let me know. You don't have to tell me what your question is. Just say, can you get me in touch with this person? I'm happy to facilitate that and make sure that happens. So let's take advantage of this opportunity. Again, once you're recognized, come off mute, ask your question, and then go back on mute so we can maximize the amount of time we have. There's about 45 minutes or so, not including closing remarks left. So with that, I'm just going to go directly to Brother Anderson. Antoine, go ahead.
Thank you, Brother Bias. And brothers, thank you so much for the presentation. A question I have is, factoring race, what is considered obese? Because I actually got my physical and my doctor said I was obese, and that's just not a reality for me. Like, that's just not true. So what exactly is the calculation, or what is obese? Like, what is that, or what is overweight for a Black man exactly?
Either one of doctors, just come off mute, and if you want to jump in, you can.
Yeah, I can answer that. So, Brother Antoine, I would say this is where it helps for you to exercise some diligence on your part and to look up the information yourself, calculate your height, your weight, and measure your waist with a tape measure around your waist, and just get those numbers. We are typically, we in medicine go by the metric system, but that's not necessary. I'm sure there are places online that you can enter the weight in pounds and rather than kilograms, and the height in inches rather than meters. And what you'll do is you'll see where you are on the scale. And you're right. Sometimes a person can just say, oh, you're obese just because of a number, but they have to also take into account your, like I said, your height, and also the way your body is proportioned. And we know that some of these demographics are based on white people. And we know that Black people have a different body habitus. So Black men have, it's been shown, like Black men have stronger, more muscular hearts. So sometimes on the EKG, for example, what we say is normal EKG, or what looks like what they say is ventricular hypertrophy or enlargement, could be normal in a person, in Black males. So I think at that point, I would just encourage you to just go and look online. If you have your height and weight measurements and your waist size, you can just go calculate my BMI. I think again, it's the height. I'd have to go back and look at my my slide, but it's basically the weight divided by the square of the height in meters. So I can send you a slide, or you can look that up online.
Yeah,
I
I
hope
mean,
that-
the biggest you know, it's what your BMI is, and you can plug it in. There's calculators online. If your BMI is above 30, you're going to be labeled as obese. If your BMI is above 40, there's some additional cardiovascular risk. If it's above 45, there's some surgical risk when you have procedures. But the mincing of words on when somebody's obese and fat, and what we think of being obese is that big, fat, sloppy person. But no, it's mainly your abdominal weight, and we all could be in better shape typically. But when a doctor says I'm obese and I don't consider myself fat, it triggers a reaction. But it just depends on your height. When we're short, like myself at 5'9" and 165, my BMI stays in the 20s. If I get my weight up to 180, which is a crazy weight for a 5'9" person, I'm now obese. But that doesn't sound like an obese risk number for brothers that are 220, 230. They're like, man, I would love to be 180, but they're not 5'9". Right? In a small frame like myself. My body is not meant to have 180 pounds. And at 180, 190 pounds, I'm at risk for having a heart attack in my 60s. So that's the answer to your question. It depends on your height. And all of us in our mind, we think we're 6'5", we can carry 220 pounds. Most of us are 5'10", 6 foot, and we need to be under 200.
All right, thank you for
Thank you,
that.
brothers.
Thank you, sir. So we did have another question come in. Is it, forgive me if I mispronounce it, Shamin? You could take
Yeah.
yourself.
Good evening.
Good evening.
Okay, so can I define obesity? I'm a registered dietitian, and thank you for this
Perfect.
program. So when you talk about obesity, we're talking about a BMI of greater than 30, and you also talk about a waist circumference of greater than 35, and I'm also looking at with fat deposit, if it's around the mid belly, that it puts you at risk for developing insulin resistance, and this is where we'll see the pre-diabetic individual that are pre-diabetic, individual with blood pressure. So we have to consider all those other factors before we call before we define. Now, you could address all those situations that you guys mentioned if you do these things ahead of time. You have to consider sleep. You have to consider physical activity, smoking and drinking, and excessive intake of fat. All those are risk factors that put you at risk for obesity. But I could manage, as a dietitian, we could manage the high cholesterol, the diabetes, and the obesity with a diet that's comprehensive, high in carbohydrate, as complex carbohydrate, portion sizes. Not, in other words, 3 meals a day with a snack, adequate fluid to help mitigate development of chronic health conditions. So there are those things that we could do to help improve those issues that we're talking about. Thank you for allowing me to share.
Thank you very much. And you can go ahead and put your hand down. We do have a couple of questions in the chat. And Brother Keith says, can you talk about the importance of taking starches and complex carbohydrates out of your diet? And I was going to ask a similar question, particularly if you have risk factors associated with one of the conditions that are involved in metabolic syndrome. Like if you have a high blood sugar, there's a relationship between starches and carbohydrates because of what your body does to carbs. And so if somebody wouldn't mind responding to that, and then I'll get to David's question.
I had mentioned in the talk the most effective diet for myself, so that you guys know I'm not selling you something that I haven't done myself, which is taking carbs out of your diet, just eating meats, chicken, fish, and fruits and vegetables. Basically, I have to have a blind spot to the carbs, to the mashed potatoes, to the rice, whatever my wife wants to fix for the rest of the family. Those are not to touch my plate, and my portions are not to touch on the plate. And that with exercise typically works. And if my weaknesses or carbs are going to be Cheez-Its, red hot potatoes, mashed potatoes, rice. These are things that just pop into my brain right away if I see them. And the reason carbs are a problem is because they take the least amount of energy for your body to break them down, to turn them into energy. So it turns into money real quick. And so carbs are real easy. Orange juice, if somebody's dizzy, we know we give them apple juice or orange juice. That sugar is not a complex carbohydrate that can't be broken down, cleaved really quickly and get into your system. So you try to avoid them, but those are diets that work for me. If you can control your calories and do the Weight Watcher stuff where you assign numbers to carbs, and you're pretty good at that, the dietitians are good at. I am terrible at that. A couple crackers becomes 10. I just can't eat carbs. I have to cut out alcohol. I have to go to water. I can cut 300 or 400 calories just by drinking water alone, and not drinking alcohol helps out. So thank you.
Absolutely. The next question was, when it comes to weight gain due to depression or life events, what are some of the strategies to start to lose weight or get a control on it?
But that's a tough question. I mean, you won. They answered the question with their question, which is we want to work on the depression, because these are moods and that affect our hormone, and these hormones also affect our cravings to eat, or they affect our cravings to not eat. But it's the underlying issue, which is the depression. Exercise is a known dopamine secretor. Dopamine is your happy hormone. So those that get addicted to exercise, like myself, they kind of know when I don't exercise, I become unhappy. So I've already gotten into the dopamine phase of exercising. But exercising, when you start out, you don't get in the dopamine phase. So that's New Year's resolution. It takes 3 to 4 months to get in the dopamine, the happy phase. So those people, they exercise for January, and by February, the gym is empty. And the people in my gym, we like to make fun of the people, they got the matching outfits still with the tags and stuff coming in, and you don't see them in February. They don't get into the dopamine phase. And you guys all know the runners, like Brother Griffin, he's a biker. If you take his bike away, he's going to get depressed because he's in the dopamine phase of bike riding. He has to bike ride. He has to exercise. There are people that have to swim. And some of you have to smoke cigars to get dopamine. You know, there's always things like that. But if you're depressed, I suggest exercise. And sometimes you need medication to get into the dopamine, into the happy phase, the healthy levels of mood. Thanks.
I would also add to that, or emphasize what Brother Cross said, was what worked for me with that is routine. Again, no matter what you're feeling on this day at this time, you have a routine and you do it. And speaking with a mental health therapist as well, or a pastor, or another trained professional to help you talk through these issues. And then if in conjunction with your doctor, if medications are appropriate, to take them.
Yeah, thank you for that. And
I needed to add, talking to, we could do a whole thing on mental health, but your happy scores, if you should score yourself 1 to 10 without using 7. You're trying to get your happy score, which is your mood, persistently in the 7 and 8, 9, and 10 area. Some people are floating around 4, 5, and 6. That's okay. You want to get your happy score, how you feel. Are you happy? 10 being your wedding day, 0 being absolutely miserable. If you're around 1 or 2, as Dr. Joseph said, you need to be talking to somebody. If you're persistently 1 or 2, you need to talk to somebody. Black male suicide has tripled during the COVID timeframe. Triple. Black men used to not be able to, wouldn't commit. So we shoot each other, but we wouldn't shoot ourselves. But it's up threefold during COVID. So thank you, Dr. Joseph, for bringing that up. Talk to somebody. If your happy score is 2 to 3, because that is who's going to swallow a bullet, and we're all going to be shocked. Okay. If you are scoring 2 to 3, talk to somebody, pastor, life coach, therapist.
thank you for that, Doctor. So I'm going to recognize our poll Mark Ellington. Sorry I didn't recognize you before, but you've got your hand up. Go ahead and ask your question.
Hey, good evening, brothers. This has been excellent information. So my question is, as we work towards the preventive part of this, what vitamins are you all suggesting that we take on a regular basis that would help with all these conditions, or preventing all these conditions?
I'm not sure what Dr. Joseph takes. I joke with patients that they often spend too much money on supplements, which makes them have expensive pee. But just a store brand multivitamin is pretty good. But the American diet isn't great. So I think by taking a multivitamin, you can kind of supplement it. Certainly during this COVID flu, it's good to have vitamin C on board and your zincs and stuff. And vitamin Bs, and if you don't have enough, if you have too much, you just pee it out and your pee turns yellow or green and stuff. And that's fine. You don't have to spend a lot of money on supplements, but making sure you get in the vitamins and a multivitamin is okay. But during the cold, vitamin C and zinc and stuff are fine. Dr. Joe, do you take any supplements?
Yeah, I do actually. The vitamin D supplement is a very important one. I think that was shown to be one of the reasons why Blacks had lower or higher mortality rates with COVID. They were shown to have a disparity in vitamin D levels. And I also take a men's multivitamin and omega fish oil supplement as well.
All right, thank you.
Thank you.
So we're going to go to Brother Gladden. Come off mute,
Yeah.
brother. Okay.
Yeah, quick question. Due to my kidneys, I'm not supposed to take the meds, the leaves and all that stuff. Just far as inflammation in the body and pain, any suggestions as far as inflammation and pain? To kind of
For
I'm not
kidney,
supposed to.
yeah, you can't take non-steroidals or should not. So Tylenol is safe for you. 4 grams of Tylenol a day is okay. 7 grams of Tylenol is a lethal dose. So if you're taking 2 to 4 500 milligram Tylenol for pain, now Tylenol is safe. It's not as good as non-steroidals, but it would be Tylenol, and then trying to avoid non-steroidals because of your kidney situation. But
Yeah, and I heard, it can deal with pain, but that doesn't really deal with inflammation per se. Am I correct or am I off?
yes, Tylenol is not, it has anti-inflammatory components. The anti-inflammatory components are not as strong as Aleve and Advils. So it treats the pain. Non-steroidal stuff such as hot topics in Maryland for cannabis and pain. Narcotics are typically trying to be avoided. Here, I do not prescribe narcotics in general, but that's just because of living in Howard County. It was kind of a candy factory, and it was doing more harm than good for narcotics. But it's Tylenol, and then very limited non-steroidals.
All right, thank you, brother. We're going to go to Brother Bruce. You also have a question in the chat, so I wanted to make sure you covered that while you have the floor.
Yeah, I was just going to cover it. Thank you, brothers. Incredible talk from both the brothers. I came in late, so I don't know if you guys covered this. What is the difference between visceral fat and subcutaneous fat, and which one is dangerous?
The visceral fat, your abdominal fat is the most dangerous fat. Subcutaneous, your forearms, your legs, these things, fat cells have blood vessels that the body has to supply, but it's the abdominal fat that takes the majority of your cardiac output, how much your heart has to work. And the loss of the abdominal fat is what increases your lifespan versus superficial, your arms and legs, but it's your belly, your core fat that you're trying to limit. And that's comes off last, unfortunately. The body likes to hold on to it because it thinks a starved state is going to come. You're going to lose your job. You're not going to eat. So it likes to hold on to keep you warm, the abdominal fat. So it's the first to pack on and last for the body to take it away.
One other thing, is that the fat that surrounds your organs?
The organs and subcutaneous. So, and if you open someone up, there's a skin layer, there's subcutaneous fat, and then there's visceral fat. That's going to be inside the cavity. It looks disgusting. It's yellow. It's oily. Fat around your heart certainly is bad because it increases the heart disease. But it's mainly the belly and the body supplying the blood vessels. Visceral fat requires a lot of blood to stay healthy. It's kind of like water in a plant or your garden. And if it takes all of your water to water this corner that's not important, which is your belly fat, your resources are going somewhere else. So.
All right, thank you.
Thank you, brother.
Thank you, Brother Cross. We're going to go to Brother Eric, but before I turn it over to him, I just want to point you all to the chat because there's all kinds of nuggets in the chat from people. And there's a couple questions, but after Brother Eric goes, I will go ahead and hit the 2 questions that are in the chat.
Hey, good evening, brothers. I too, I'm coming in a little bit late. Ironically, I'm coming from the gym. But my question is, so I have been battling high blood pressure for, well over 25 years. I can say I recently had my physical and my numbers were down. I was at 126 over, I think, 80. So I was pleased with that. Recently had knee surgery, replacement knee surgery. So the weight is, I'm doing everything I can to bring the weight down. My question is that I've been taking lisinopril. And then I've been reading reports. I take lisinopril, I take amlodipine, and I think I know I'm messing up, asterolvastatin. But my question is in regards to lisinopril, I have been reading reports that isn't necessarily good or that has had adverse effects in the African-American population. And I actually brought it to my doctor's attention and, failed to bring it to because I was concerned if it's causing more harm than good to my body, to my heart. So I wanted just to get some feedback if that's something that I should definitely discuss with my doctor about getting off of that and still taking the other 2 medications that I'm taking or continue to take the lisinopril.
Okay.
You should definitely take the lisinopril if your doctor is doing adequate testing with your renal functions or kidney functions to make sure that it's appropriate. And as long as you're not having one of the big side effects that I see in my practice in the emergency department are people having what's called angioneurotic edema. It's like swelling of the lip or tongue associated with it. Sometimes people have to come off of the lisinopril because of that. Also, sometimes people have to come off of it because of can cause a very severe and persistent cough. But I wouldn't just discontinue it or annul it because of a prevalent opinion or just some concerns that are not specific to you and something that may be for a population. But I'm sure Dr. Cross may have insights into this area that I don't.
Yeah, you're correct. There's a study that showed ACE inhibitors do better for our white counterparts than for us. So if your doctor is African American or what I call friendly white people, black friendly white people, they would be aware of that. And you just bring it to their attention, and it's the best cocktail for you getting that number down. But yes, you're correct that ACE inhibitors did more add-in summers to white folks, and we know that there are some differences amongst the subcultures, but a lot of us do have some white genes in us, so we do get some of the white benefits. We just typically look black, and we get treated and get all the bad effects of looking black, and we don't get the pluses to not looking white. But that being said, some of us as African Americans do fine with ACE inhibitors as well because of our genetic mix-up. So we look black, but you're 40% white, ACE inhibitors may be okay. So that's a little bit longer answer. But if ACE inhibitors plus, say, calcium channel blockers may be the thing for you, but it's talking to a white, black friendly doctor or African American doctor that should be well versed in what's the best blood pressure for you. And your doctor should be very comfortable talking to you about African American issues, be them black or white. Because if you're a black doctor, you need to know white problems, right? I need to know their issues when they come in the door, and I need to know black issues as well. But I need to be diverse and well versed in their issues, and your white doctor needs to be diverse and well versed in your issues as well.
Okay, appreciate that, brother. Appreciate great information. Thank you.
All right, and thank you for your question. So I have 2 in the chat. One is about mineral assessment tests. Is it true that you can request a mineral assessment test from your primary care physician to detect any deficiencies as opposed to just taking like a multivitamin or just taking vitamins in general? And that, I guess, would be a more targeted approach to trying to take care of any deficiencies. And what are your thoughts on that?
You can get vitamin levels done. Vitamins and minerals are just to get in the vitamin levels done, but most of us, Black folks, can be known to be low in vitamin D. So getting that checked, or sometimes requesting to get your vitamin D levels checked to see what they are. You may be high on vitamin D, but you may be getting enough sun. But some of us are working indoors. Some of us are working from home, not even hardly going out. We got big houses. We park in garages. We don't even walk outside to go to our car. So we don't get any sun. So our vitamin D levels may be low. So checking the vitamin levels. I'm not so much aware of getting minerals done, but just taking a multivitamin helps with that. But certainly getting it checked. There's no harm in a blood test if they're usually covered on your general physical.
All right.
The normal blood testing panels that a physician will order does include, if I'm reading it correctly, minerals or electrolytes. So you do get your magnesium level, your calcium level. You'll also get your potassium level and certain B complexes and B12 and folate, and vitamin D levels are checked routinely, and I get those yearly.
All right, great. So we have another question in the chat before we go to the hand that is raised. How do you all feel about non-prescribable alternatives to medication like turmeric, forte, aloe to help mitigate any pain or anything like that? What are your thoughts on that? Herbal type of alternatives.
All alternative medicine are alternatives to Western medicine that can be looked into, respected, and if it makes you better and feel better. For example, what is the primary endpoint you're treating? So if I do alternative medicine because I have migraines and I still get migraines, then it's not working. But if I do alternative medicine to my migraines and I'm able to come off prescription medicines, I support it. For blood pressure, there's not a symptom often for African Americans. So we spend more time with folks say, I'm not really a pill taker. I don't want to take any medicine, so I want to do alternative stuff, but they need to objectively make sure their blood pressure is the systolic number and diastolic numbers are down with that alternative. Just because you feel okay doesn't mean you're okay. And that's very, very important for all of us as men. Just because you feel okay doesn't mean you're okay, because your hemoglobin A1C could be double digits and you feel okay. Your blood pressure could be 180. My brother-in-law came to get his colonoscopy physical in my office and had to be carted out in an ambulance because his systolic blood pressure was 200. His bottom number was 100. And he was coming from work just to see my friend to get for a screening colonoscopy. And the doctor almost had a heart attack, like coming to grab me, for his name is Fred, your brother's blood pressure. They had to call an ambulance. It was so high, you can't safely put a Black man in a car and have him drive to see Dr. Joseph at the ER for fear that he may have a stroke driving, and you're medically liable for that. He had 0 symptoms, got admitted to the hospital, was in the hospital for 4 days. It took them 4 days to control this brother's blood pressure. He had 0 symptoms. And he is a problem only because his father, my father-in-law, had diabetes, hypertension, worked for IBM, did fine, knocked off his kidneys, got on dialysis, had a kidney transplant. So he's well-versed in the effects of uncontrolled blood pressure. But because he was feeling fine, hanging out, drinking, Pittsburgh Steelers fan, they're beating the Ravens, he's having a good time, blood pressure 200 over 100. Could have had a heart attack, just turned 52. He did not, but he only was found out because he came to my office to get a screening colonoscopy. Otherwise, he was just on thin ice. And I told brothers like that are on thin ice, skating from one side to the other every day. And because the ice doesn't break doesn't mean they're okay. They're just making it to each side. And because they feel okay, does not mean the brothers are okay, because a blood pressure of 200, when I saw that, I didn't want to get too scared for him, but I'm like, whoa, his creatinine was elevated when he got to the hospital. It was 1.9. All his stuff is turned around, but his body was kind of hanging in there, but he was a ticking time bomb.
Wow. Thank you for sharing that. T, you got your hand raised?
Yes. Hi, everyone. Thank you so much for holding this evening. Very important. And I just wanted to share, I am a person who have had 2 kidney transplants, and I wanted to chime in. First, I was diagnosed in 1993 with IgA nephropathy, nephrotic syndrome. And as a kid, I only suffered with like edema, swelling in the hands, swelling in the feet, and really had no signs or symptoms until I went to the doctor with flu-like symptoms, and they did a dipstick in my urine and found out that there was blood and protein. And from there, I went to the nephrologist and they did a biopsy, and then they found out I had kidney disease. But I wanted to just touch upon what you said about the silent killers. Diabetes, high blood pressure are those silent killers because we don't have signs and symptoms. And so I just wanted to add the importance of everyone, whether it's female or male or even our children, the importance of making your doctors accountable for checking that, hey, hemoglobin A1C, number one, that should just be a part of your annual physical just because we're African Americans. And more importantly, when they're running your lab work, you have to request a renal panel. It's your job to really stay on top of it, because these things are like a needle in a haystack and don't always show until it's the last minute. You're in stage 3, stage 4, you're on emergency dialysis. Now you're scrambling, trying to find a relative or friend or loved one, anyone who would step up and donate a kidney to you. So I'm just saying it is so important to really know what to request and advocate for yourself and your loved ones, because I always tell people that sugar and that salt is Black people's kryptonite, and everybody knows it kills Superman on sight. So we got to be diligent with our health and add those things when we're going to the doctor as part of our annual physicals.
Thank you for that. And you also had I think you had a question in the chat about getting rid of belly fat. Did you want to ask that now, or?
Yes. How do you get rid of that belly fat?
Easier for men than women. Post the hormones of belly fat is harder for women to break it down. So when we talk about exercising, for a man, what a man could do for 30 minutes to break down belly fat is going to be 40 to 50 minutes for women. It's going to be a diet. There's no special crunch or abdominal exercises to increase your abdominal muscles, but it's going to be limiting calories and burning it. But the body for women does hold on to abdominal fat longer. One, it thinks you're going to starve and you're going to need it to raise the family. You know, these are all evolutionary remnants that we don't need anymore, but it makes it harder for women to lose it. They can cosmetically get it cut away because sometimes the body just won't touch that last little baby pouch. It just will hold on to a period. The person could starve for 6 months. It's not going to go anywhere, but their BMI is going to be okay. If you diet and exercise, the BMI is okay. It's not cosmetic stuff there. But yes, it's harder for women to lose abdominal fat than men, but it's not easy to lose abdominal fat, period. Men and women struggle with that.
All right. Thank you for that. Brother, Dr. Joseph, you can go ahead and jump in.
Question I had for the audience at large is, what are the challenges that you face with getting the screening, one, and two, following the physician recommendations, especially as far as medications, because what I have experienced personally is on the receiving end from what Dr. Cross referred to with his brother-in-law, and then like one of my close friends, and then another frat brother of ours that Ron and I, associated with, that was really close to Ronald Taylor, someone who I think had high blood pressure, known high blood pressure, but also did not take the medications. And just wanted to know what people thought about that. Like, what were the challenges that people feel around that, taking the medications?
Excellent question. I'm going to jump in. Raise your hand if you want to share. I can tell you, and firsthand and personally, and when Antoine mentioned this like earlier on, I kind of cringed a little bit because he took me back to who I was, 20, 25 years ago. If my doctor told me I was obese, I looked at him like he was crazy, and I was like, I don't need to do anything. And the biggest thing that we need to learn how to do is look at the person we see in the mirror and be honest, and even if you feel like what you're hearing isn't true, you should still give it its just due and do some due diligence, because there's no harm in you looking into it and verifying that your thought is correct or that your belief is correct. The worst thing you can do is just write it off and do nothing. And one of the things that I did as a young, because I was a black belt martial artist, used to train 6 days a week, but I stopped like when I was in my 30s. And that's when everything started to change. My metabolism was slowing down, but I'm still thinking like I'm 30 or 25. And we have to learn to recognize as we transition into different phases of our lives, because our minds are going to tell us we're still capable of doing what we used to do. Your body's like, nah, bro, you can't. And a lot of us learn the hard way. And one of the things that I heard, and this is the last thing I'm gonna say, I heard Bill Clinton say that by the time he realized he had an issue, the damage to his body had already been done. And the fact of the matter is that we could be doing damage and just not know about it yet, because that health event hasn't occurred. And so I want all of you all to take heed to what Brother Cross and Brother Joseph are saying, because you might feel fine and not even know it, just like the example that Brother Cross gave. So that's what I got to share. I'm gonna turn it over. And I go to the doctor every 3 months now. I had a health event earlier this year. Praise God that it wasn't life altering. I mean, it was life changing because I've changed my diet and now I'm working out more, but this is real. So Brother Ellington.
But to your point, Brother Bias, he was working out when he was younger and then he stopped. The biggest thing we see that is with football players. The football players are in excellent shape when they're playing football. When the ball stops moving or they stop playing, they typically turn into fat. They keep the calories up because they have that atomic habit of eating high calories to keep the muscle mass on. They don't scale their diets down, and so they stay large. But the average age of death for football players, most of us know this, but many don't, is 59. So football players are predominantly Black, correct? And we live to be 68, 70 on average. So playing in the NFL loses you 12 summers. Okay. So what we want our kids to do becomes detrimental to their health if they don't make major life changes after they stop playing football. But if you play in NFL, your average age of death is 59. That is not a good number. 59 is still young. Hell, I'm 52. But that would mean I have 6 summers left, right? 7 summers left. But that being said, the time for football players is what Brother Bias was just mentioning. They have high caloric intake, they have high activity, and the ball stops and they stop doing all those things. They continue eat and they don't modify their diet and they die very young. 59 is almost 2 decades too early.
All right, thank you. Brother Ellington.
Yeah, I was going to Brother Joseph's question. I think for me, over the years, it's been finding doctors you can trust, their information that they're giving. A lot of times you go to doctors and they rush you through. They tell you, do this, and you ask questions and they don't have time, or just trying to even get an appointment with somebody you trust because it's very hard. So to your point, Brother Joseph, getting doctors to sit down long enough to talk to men and answer their questions, like this is obviously an amazing forum, but to get a one-on-one conversation with a doctor to ask the questions that needs to be answered and to trust somebody, I think is the key to whether or not someone would continue to take medicine or even take the medicine because they don't have the answers and not trusting what someone's saying. And I can use that in relation to my daughter. My daughter went through years of pain and going through a lot of doctors and emergency rooms and such. And it wasn't until I called somebody I trusted, which was by chance, Dr. Cross, in the middle of the night and said, I need some help. Like, I'm not getting the answers. And he stopped what he was doing. He took her appointment and he did all the tests and ran through it and has helped my daughter, live a much better life. But it's because I trusted him that we were able to, and because it took the time, that we were able to kind of get answers. And it took some time to get the answers. So, I always give him thanks. I, again, appreciate you, Kester, for that. But that's, I think, where there needs to be some adjustments because a lot of these doctors are moving fast. We don't have a lot of time because we're moving fast and trying to find that balance of information and trust is where I think a lot of Black men end up not going to the doctor a lot and not taking the medicines is because we don't have that connection.
Thank you, Brother Ellington.
So
Doctor?
that's outstanding, Brother Ellington. But what on this forum, I want to share with the brothers, connecting with your doctor is very important. Use your people skills that you use in sales, that you use in meeting brothers. Get your doctor to know you and see you. And if he can't or she can't, then you need to get another doctor. But you have to be seen by your physician and doctor to get better care. If you're not known, you're going to be almost like on that cashier going through boop, boop, next person. They need to see you, and you have to see a doctor that actually sees Black people as human beings, 4/5 human beings, not 3/5. You are the paying customer. You pay that doctor $100 an hour every time they go to see. You pay me $250 an hour when you come see me. And because of that, I like to know something about my patients and connect with them because you get better care. But you have to make sure you connect, use your people skills. All of you guys have them. And it's almost like dating. If it was a woman and you were trying to get to know that woman, if you were single, you would use your people skills to get her to like you. Use those exact techniques to get your doctor to know you. How's your day going? Find out about their family, where they're from, use those people skills. Where you from, doc? Where I'm, and connect with something that you have in common with that doctor and bring it up when you meet with them. Hey, how's your son doing in school? That improves your outcome and improves your care. Okay, I saw Mark's daughter. I mean, he's a new Kappa, but this was before Kappa, I think. But these are my friends' kids or my kids. So I got to take care of them like they're my children. But that's the connection. But that's the same thing for everybody else. Get in front of your doctor. Make sure they know you and know something about you. But make sure you know something about your doctor that connects you to them, and you'll get better care. You'll live longer if your doctor likes you.
All right. Dr. Taylor, Ron Taylor. Mark,
Yes, I want to address one of the questions that Brother Joseph, Dr. Joseph was asking, and I feel that a lot of Black men have a little apprehension when it comes to taking medication for blood pressure, cholesterol, or diabetes because they have a fear that it may affect their sexual performance. And I want to know from Dr. Joseph and Dr. Cross, is this urban legend? Is this a myth? Or is there some truth to that?
A little bit of both. The way I counteract that with folks is uncontrolled diabetes, uncontrolled blood pressure. Your penis is going to stop working anyway. Okay, so that is just a fact that your penis will stop working 10 years before it's supposed to if your diabetes and blood pressure are not controlled. So with that fact in place, we need to find a blood pressure medicine or lose weight to the point where we don't have the side effect, because some blood pressure medicines do have the side effect of affecting our nature, which affects our manhood and stuff. And there's medicines for that. Viagra was initially a blood pressure medicine, and the men came back and said, I don't know what my blood pressure is, but my penis is hard as a rock. And then they switched to it being a performance enhancing for sexual enhancement. But yes, it's true. More importantly, men don't like taking medicine because they don't like taking pills if they don't feel bad. Number one. Number two, they don't like being told what to do. But what motivates men is often longevity, wanting to be around when their friends die, when their parents die, when they see death, that motivates them. So the hardest person to sell on taking blood pressure is a young 40-year-old man and all his friends are alive and they're still partying, traveling, having a good time, smoking cigars. It's really hard to connect with them because they still think they're going to live to be 80 years old. It's not until their 50-year-old friend dies that they start saying, hey, what the hell's going on? So it's connecting with them. But yes, there's some truth that some medicines lower our ability to get erections, and we need to find the magic of a bullet for that.
All right, thank you. Before we go to Brother Parker, Dr. Joseph, did you want to say something before I?
Yeah, I just was saying that yes, that is a known side effect of a couple of different classes of medications. If I remember correctly, spironolactone is one of the medications that can cause breast tissue in men, and also I believe the beta blockers, that class of medications as well, has some untoward side effect as far as sexual functioning in men. But as Dr. Cross said, there are other alternatives, and these disease processes themselves cause sexual impairment. So that is definitely a problem, like you said before.
Absolutely. So before we go to Brother Parker, there is another question in the chat from Brother Valines. What happens if I change my diet and my blood pressure, cholesterol, etc., are not coming down? What are some tips that you might have to help us recognize our stress levels?
Stress management, exercise, and then we're going to need pharmacy to lower. Some people have to take 3 blood pressure medicines to get it under control because their blood pressure genes that have been passed down in their family, they're pumping high, so they're going to need medicine. Stress raises your blood pressure. Work stress. The most common time to die is Monday morning. And what's significant about Monday morning is men wake up and they're thinking about their work day, and women wake up, they're thinking about their work day and they get stressed. And so they go see Dr. Joseph in the ER. The most lethal time is Monday morning, and that's related to work. So managing life-work balance is important. But I talked earlier about, hey, what's your happy score? On my phone, under my notes, I have in the morning, I wake up and I score my stress score 1 through 10, not using 7, and I do my mood, my happy score. And why that's important is I have to ask these questions of myself, my self-assessment. I work out at 5:30. I pick working out in the morning only because it motivates, because I think my competition is sleeping. I think everybody else out there is sleeping and I'm exercising, getting better. And before I get everybody else better, I'm getting myself better. It may be, I could have a heart attack next week, you know what I mean? But basically that's what gets me outgoing. But what I do for mental health and stress is I score that. And just 2 weeks ago, my stress was at an 8, but because I scored it at an 8, then I have to look what is stressing me out and how can I modify that. If it's people, I move away from them. If it's things, I move away from them and put them down. I find ways to slay the stress dragon, but I hit it directly on it, but I have to score it first. So I haven't needed stress medicines, but I've come close from needing stuff. I've had to see a therapist mainly because, for those of you who know me for a long time, I was married 24 to 29. That was devastating for me. So I had to see a therapist just because divorce is like a death, but it's not treated like that socially. But I haven't been that dark since then. I've been living good for 20 years now, but I share that only because there are people that are in dark spaces and you have zero idea. But if you score it yourself and you're scoring 2s and 3s persistently, talk to somebody because you're taking summers off your life. And none of your friends, outside of knowing that when men are stressed, they text less, they hang out less, but most of us just assume the brother's busy. That's the biggest sign that a person is depressed. They hang out less, they text less, but they also could be busy, and we're all busy. So you don't know that, but we need to take it upon ourselves to see what our stress scores are, what our happy scores are, so we can live longer.
Absolutely wonderful information. So Dom, let's go ahead. If you got a follow-up to your question, maybe I didn't ask it right. We're running short on time. So Brother Parker, if you didn't want to ask your question, this is going to be the last one.
No, I was just going to make a statement. I had last month I had a situation in which I had elevated troponin levels when I went into my appointment. I was going in for my VA appointment, believe it or not, to the VA, and I said, you know what? Even though I'm going for dermatology, let me go over here to the emergency room and just have them look at my, do an EKG and just make sure everything's all right with my heart because, I was having some chest pains. And lo and behold, they found out that my troponin levels were elevated. And they ended up keeping me overnight at the VA, particularly as far as with my heart. And ended up having to take a stress test, nuclear test, and everything else. And I had just done that probably about 2.5 years ago, maybe 3 years ago, when Vernon and all them, they were talking about the importance of taking the stress test, nuclear test, and all of that. And it came back fine. But what I realized is that, as it related to like the blood pressure and everything else and the stress that was going on, I was doing real estate stuff and this, that, and the other. But those raised troponin levels, had they not checked it and found that inside my blood or whatnot, who knows? What could have came of it. But what they came to find is that it was acute and just kind of like directed stress for what I was really dealing with, so. But I tell you, Mom, that's all. I just want to share that. That's all.
All right. Thank you, brother. All right. So we're going to go to Brother Valines and then I'm going to close us out.
So the follow-up, the reason that I asked the question is because I think sometimes like I can definitely speak to me. I was also in that place before because I've been divorced and like really not too many people know that I've even been married. But the other thing is like the job that I have, I'm a law enforcement officer. So sometimes like I think that we're as law enforcement sometimes or military, we're under such intense stress sometimes for so long that we don't realize that we're under intense stress. So I know for me, I know I'm not the best when it comes down to like my eating and my diet. So I've been working on like, hey, you got to get a handle on eating better, portion size and stuff like that. But listening to everything that's come out today, that was the reason I asked the question, because I'm like, well, what happens if I'm changing my diet and like right now, my heart, everything, all of my cholesterol, my blood pressure, all that stuff is in great shape. But I'm like, what happens if my rates or my levels spike, maybe in 3, 4, 5 years? And I'm like, well, okay, like, let me change my diet. And I changed my diet and nothing still is happening. I'm like, is that like, what tips did you have in regards to like maybe checking the stress? Because maybe that's what's elevating, my blood pressure or my cholesterol and stuff like that. So I appreciate the input and the insight.
paying attention to it, but stress management is tough, as Dr. Joseph to tell you. It doesn't go down quickly, but all of us should have blood pressure machines. I forgot to say that, should have blood pressure machines that we check our blood pressure at home. They cost $39.99, and you guys all blow that on, you know, a days out, just that you can check your blood pressure at home. But go ahead, Dr. Joseph.
One thing that Dr. Cross did so astutely and sounds like almost intuitively is the whole adding mindfulness to his daily daily rituals of living. And we can use technology now. We have, in particular, the Calm app is one that I am familiar with and that my wife uses. And just when you talk about stress, it was just so powerful to hear Dr. Cross talk about like him taking that moment to just be aware of how he's feeling, what he's feeling, and then using that as an inspiration to make a change. And I would say for you, Brother Dom, again, just taking something from Dr. Cross's script and just starting to add that happiness score to your daily ritual, and also maybe checking out the any of these apps or free apps that foster mindfulness and self-awareness.
Absolutely. The scoring yourself, brothers, is what's important. Your happy score, your stress score, but also when you go one step farther, asking your brothers what their scores are, you really impact your brothers. If you ask them, hey, what's your scores been running? If we start scoring ourselves, we know numbers. Men know numbers like anything else. You're like, hey, you know, so if I were to talk to Mark and say, hey, man, what's your happiness? Because everybody is all good and fine in the first 5 seconds. When we see brothers, we grip each other up. How you doing? Oh, it's all good. Everybody's good and everybody's fine. So we know half of us are lying, right? But we just don't want to share because it's a sign of weakness. But if you can peel away, sometimes people do one-on-one, hey man, what is your happy score? Well, I don't know what you mean by that. Well, if getting married or the birth of your child was a 10 and that was your happiest day of your life, tell me how you've been running. And you 5, 6 you can deal with, 7, 8, 9, you know, tell people don't use 7. But if they're telling you 2s and 3s, ding, 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 pay attention to that, brother. Even if they're being extra, follow up with them, be like, hey man, how you feel? You still in the 2? Most of the time when you follow up, they're like, oh no, I was just tripping, man. My manager work was getting stressed out. But police officers, as the brother was just saying, that is a highly stressful job. It has a divorce rate of 75%. When a cop gets married, you almost know he's going to get divorced. They don't go into that thinking that. They don't go into that knowing that. Doctors, 75% divorce rate because of stress that goes into that. Cops have high suicide rates, but the most lethal job are dentists and anesthesiologists. They kill themselves more than cops do. And they're in the healthcare field. Why? Because doctors don't take care of themselves because they spend a lot of time taking care of everybody else, and they don't take the time. So that is why I share with you that I score myself, because I know I need to score myself. I need to make sure in the setting that I'm in, being the chairman of my state and stuff like that, there's a lot of pressures. I feel like everybody's trying to get me off. The higher the monkey climbs up the tree, the more his butt's exposed. So you got to watch all your angles and stuff. That stuff stresses you out. People want to knock you off your line, your success. Once you get up to the top, you got to stay on top. That stuff can be stressful and you have to manage that. But I would encourage everyone to score their happiness and score their stress. And you'll find, you say, why is my stress high? And you just attack it. You attack it like it's an enemy, and men do that great. But what happens is we don't pay attention. We pay attention to everybody else's problems around us, and we get knocked out. And once we're out, the devil's winning. It has your wife and your kids. Once the devil gets you and affects your health, You can't fight anymore. It's easy to kill your wife. Easy to kill your wife. Easy to kill your kids. All they got to do is get you, and your wife and your kids are done. So that's why you want to stay strong and healthy.
Wow. Well, thank you for this information, you all. This has been an incredible, incredible presentation. I'd like for our participants to give you all a round of applause. Thank you for all the participants. We are a little bit over. We're about 6 minutes over, but I hope you found value in this. As we close out, I'm going to ask, if you're not a member of CPSS, we have some spouses on. We've had some other guests on. If you want to be notified when we have our next session, because we are going to do a session earlier next year on mental health. We're going to do one on oral health and hygiene, and we're probably going to have a couple other speakers. If this is something that you're interested in, drop your email address in the chat. I'll make a note of it, and we'll make sure that you are notified before we get ready to do the next town hall meeting. And by the same token, if there is a topic, whether it's health, whether it's science, whether it's wellness that you want to have us look into, we're happy to do that as well. Just drop that information in the chat. I'm going to stay on afterwards, gather the information, and that'll help us chart our way through the summer and into the next fraternal year.
Hey, brother Bias, just real
Yes,
quick,
sir.
for those brothers that are part of the chapter, they can join your committee as well and participate and help run these and get together all the information and speakers. So
I'd love that. Yep, absolutely. We have plenty of opportunities. Brother Gladden's heading up the Speakers Bureau. I'd like for somebody to help lining up speakers with Brother Gladden. If somebody wants to take over and moderate some of these, I'd love to have a moderator. So there's plenty of opportunity. The more hands we have, the more impact we're going to have, because I'm all about results and impact. So we'd love to have you all participate. You know how to reach me. You can get me on Slack. You can send me an email. Please join the committee if you're interested. We will be meeting, I believe, next week. And I'm happy to give you that information as well. So again, thank you for your time. And with that, we will call it a day. But, drop any suggestions you have, and we will be sure to look at them as a committee and as we move forward.
Thank you, Brother Bias.
Thank you all. Thank you, Brother Cross. Thank you, Brother Joseph.
Thank you.
Awesome.
Thank you, brothers.
Outstanding job.
Thanks a lot, brothers. Awesome job.
Outstanding.
All right. Good night.